Good morning. We're going to begin the webinar shortly. We're just going to allow a few more seconds for more people to log on. Good morning. I'm Amy Rowley-McGee, the president of the Health Policy Institute of Ohio. Thank you for joining us for today's online forum, Politics, Perceptions, and the Pandemic. We're glad that we had such a high number of registrants for today, and we look forward to a informative conversation. The mission of the Health Policy Institute of Ohio is to provide the independent and nonpartisan analysis needed to create evidence-informed state health policy that improves health value. I want to thank our core funders who advance our mission with their steadfast investments in our work. I also want to thank the Cardinal Health Foundation, which is our presenting sponsor, as well as all of the 2020 Forum Series sponsors for their generous support of our online forum series. We encourage you to tweet throughout today's webinar using the hashtag HPIO forum. If you have questions for the presenters, please type them into the question box and we will pause periodically to take the questions and read them to the speakers. The COVID-19 pandemic has renewed interest in health policy, spotlighted the importance of a strong public health system that balances individual rights with the health of communities, and highlighted the link between racism and health with the disproportionate impact of COVID-19 on communities of color. With record turnout in the November 2020 election, voters sent clear messages about their perspectives on these and other health policy issues. Today, we're going to explore what the election results tell us about the future of national health policy, the political environment in Ohio, the future of public health, next steps for addressing the COVID-19 pandemic, and efforts to address racism and advance equity. This is indeed an ambitious agenda for a 2-hour forum, but we're very pleased to have such a great group of experts with us today to share their insights on these topics. We hope that you come away from today's forum with information that's useful to you, your organization, and to your efforts to influence policy change here in Ohio and locally and nationally. Today's presentation slides and other resources are available on the HPIO website and can be found by clicking on the Events tab. I'd now like to hand it over to Matt Harmon, who is on our board of directors at HPIO, to introduce our first two speakers.
Thank you, Amy, and good afternoon, everyone. I'm Matt Harmon, Vice President of Clinical Solutions at Employers Health. Been lucky to serve on the board of directors at HPIO for the last 3 years, and Employers Health has been a proud sponsor of HPIO's forums since 2014. I'd like to welcome our first two speakers for today's forum, Dr. Melinda Bunton and Dean Trevor Brown. Dr. Bunton is the Mike Curb Professor and Chair of the Department of Health Policy at Vanderbilt School of Medicine. She will be discussing what's on the horizon for health policy at the national level as a result of the 2020 election. and Dr. Brown is a professor and dean of the John Glenn College of Public Affairs, as well as the executive dean of the professional colleges at The Ohio State University. He will provide an update on the political environment in Ohio. So now I'd like to turn it over to Dr. Button.
Thank you so much. I'm really delighted to be here today and to be speaking on behalf of an organization whose mission and vision are so closely aligned with my own. I think we have such a need for objective, nonpartisan information about health policy, and especially at a time like now. So if I can be given control to advance my slide. I'll say that what I was asked to speak about today was a very long list of things, which I will hope to cover. And Alana, I am trying to advance the slides and it's not working yet. So maybe you can advance to my title slide if you can.
I will. So I will try to give it to you again. Go ahead and give it a try. And if not, I'll do the advancing for you.
Okay. It is still not working.
Okay, I'll take care of it. Just say next slide, please.
Okay, great. Next slide, please. All right, I was looking through my slides last night and I realized that even my title slide was a little emblematic of the moment we're at right now. This is certainly not a blue wave coming down from the left-hand corner of the slide. What we have are two fairly equal portions of the country covered by blue and red, although not traditionally the way you might see it on your CNN screen or whatever your preferred channel is, and a very, very faint glimmer of light, grayish light between the two. I will say that the 2018 election was really about traditional health policy issues, which I'll go through to set some of the background. But the reason why there are probably 250 people on this webinar, and this is the third such webinar I've done in the past 24 hours, is because we are in the midst of a global pandemic. And so just as you just heard from Amy, this has brought so much focus to the topic of health policy and exposed so many gaps in our system. So next slide, please. To set the stage for the way that we think about health policy traditionally, we might start with a comment about how many states have adopted Medicaid expansion since that became an option to begin January 1st, 2014. So we're now up to 38 states and the District of Columbia. Next item. But 2 states have been added. Thank you, Alana. Oklahoma and Missouri made this decision this year in the midst of the COVID-19 pandemic, and their expansions will be effective next year. In those states that have expanded, next item, there has been a decrease in rates of uninsurance due to the expansion, and that has been across different racial and ethnic groups. Next slide, please. However, since 2016, so since the last presidential election, the number of uninsured and the rate of uninsurance among the non-elderly has increased. And this has been because the Trump administration has taken a number of steps to roll back provisions of the Affordable Care Act. And I'll describe some of those. Next slide, please. In addition, we've continued to have family premiums and deductibles rise and outpace workers' earnings. So on this slide, the dark blue line is the cumulative increase since 2010 in workers' earnings. Overall inflation is a little bit below that in the lighter blue line, but family premiums and deductibles have risen much more dramatically. In fact, a premium for a family of 4 is now well over $20,000, while the poverty rate for a family of 4 is about $26,000. So really a family health insurance premium being almost the same as the poverty rate in this country at this point. Next slide, please. So all of this is happening, though. We're having this discussion about insurance, about racial inequities in insurance, but also in health and health care, at the same time that we are facing a pandemic and we are spending money to try and pull ourselves through what is truly a global catastrophe. So on this slide, I show a picture from my former colleagues at the Congressional Budget Office. And I've drawn two vertical lines on this, a vertical line for the passage of the Affordable Care Act, another one for when Medicaid expansion, as I just mentioned, went into place in 2014. And then you can see that large dark spike in the middle, right over 2020. And that's the spending that we've incurred because of the pandemic to subsidize people's incomes and other emergency spending because of the pandemic. We will eventually, of course, have to pay off that money that's been added to the national debt. And so while that top line, labeled major healthcare programs, is expected to be increasing over time through 2050, as shown on this slide, because healthcare costs have traditionally outpaced inflation in general. We're also going to have to be grappling with increasing into the future payments on the national debt. Next slide, please. And so this has led to some of the discussion about competing priorities between Republicans and Democrats. And so there's been a contrast between Republicans who wanted to repeal and replace the ACA and Democrats who want to build on the ACA, between Republicans who want to give states more authority through waivers and block grants, and through Democrats who would rather make coverage universal and more affordable through uniform federal policies. Also through Democrats wanting to build on the Medicare program, as Biden proposed, by lowering the age of Medicare eligibility to 60, and by offering a public option to those people who are in either the coverage gap, or even for some people who might want to switch out of employer-provided insurance into a public option based on the Medicare program. In contrast, Republicans who would like to see more flexibility in the design of insurance policies, perhaps the sale of cheaper policies with more restrictive benefits. And there's been very little overlap, if you will, between these two different visions of where we should go in the future, except for the item that I put in the middle of this chart, which is an agreement that healthcare costs are too high and need to be brought down, but just very different approaches for trying to do that. Next slide, please. Now, I had to sneak in a little bit of my own work. This is a chart from a paper that a colleague and I published in Health Affairs at the 10th anniversary of the Affordable Care Act. And no matter what you think about the Affordable Care Act, we sort of pulled together evidence, and there's really no evidence that the Affordable Care Act accelerated growth in healthcare spending. So healthcare spending has traditionally grown faster than other sectors, but during the period of time since the ACA passed, has arguably been one of the slower periods of healthcare cost growth in recent history. It also was some of the growth, as you can see in the middle of the slide here, was driven by coverage expansions and changes in the costs of prescription coverage, which really are different things than increases in healthcare costs on a per person basis. So before I dive into what a new Biden administration might do, next slide, I wanted to address one of the issues that we thought would be a huge deal during the election, the Supreme Court case California versus Texas. So with all the pressure going on with the election and everything else, then there were these oral arguments in front of the Supreme Court, next item. However, the way they turned out, it would appear, and I'll have to read you this because it's cut off on the bottom of the slide, at least as far as I can see. The oral arguments that we heard really do indicate that the Affordable Care Act will be upheld by the Supreme Court. There seem to be a number, at least a couple of different ways the Supreme Court might decide to preserve most of the Affordable Care Act, even if they decided that the individual mandate or requirement that individuals hold health insurance, even if they decided that that was unconstitutional. Next slide. So where are we? We are still, just like in my first slide, in a fairly divided state of the world. We have Joe Biden with a pretty clear electoral college win, next item. We have a House of Representatives, which is still in control of the Democratic Party, although to a lesser extent than it was coming out of the 2018 election. Next slide. And we have a big question mark about the Senate. We don't know if it will be 52-48, if it'll be 50-50, but either way, it's really such a evenly split Senate that this will be a major constraint on anything the new administration tries to do. Next item. So the real challenge for Joe Biden and Kamala Harris is to figure out how to heal. And I would like to use that in multiple senses. They're going to have to figure out how to heal our national pandemic response and how to heal this rift about the Affordable Care Act and move on in health policy. Next slide, please. So what can be done in this situation where we have a very divided country about the approach we should take in health policy, and we have a very evenly divided Senate? There are a few things that the Biden administration could do in terms of presidential actions. So the Trump administration was able to put in place a number of different executive orders and regulations that had the effect of unwinding parts of the ACA. And those can be reversed. If they were implemented by executive action, they can be reversed. So I expect to see some of that happen. Their major agenda item, this really should have been the top of the slide in big bold, though, will be to organize and most likely federalize the COVID-19 response. So just as in health policy, Republicans have typically wanted to devolve choices to the states, the Trump administration has devolved many decisions to the states regarding the pandemic. I would expect the Biden administration will consolidate, organize, and federalize a lot more of the COVID-19 response. And that will include things like testing, supplies, personal protective equipment, and really importantly, given the fantastic news we've had this week about the vaccine administration and allocation. Then, assuming, which I hope I can assume, that there's a point at which the pandemic is brought further into control, there's an organized plan for vaccine delivery and dissemination. There may be some laws that have been already considered by the Congress, have already had some bipartisan support, and which could get done in a new administration. And those include some legislation around surprise billing and around drug pricing. It's possible. It will see if Biden's personal relationships and the attitude of our Senate Majority Leader, what they are towards this type of bipartisan legislation. And then over the long term, I think the Biden administration will try to take steps to augment the Affordable Care Act, to do things that cover people who are not currently covered with health insurance, and that can include extra incentives to expand Medicaid or making that easier, options for people who fall in the coverage gap in states that don't expand Medicaid, and further Medicare-based reforms along the lines of the idea he proposed of lowering the Medicare eligibility age. All of those things require legislation, and they all require additional funding. So they cannot be done by the administration alone, and they will be being proposed in a very tough fiscal environment for a number of reasons. Next slide, please. Next item. So what might revamping the federal response look like? As I alluded to earlier, I think that there'll be more centralization at the federal level. There could also be things like expanded relief for the cost of treatment. People are now talking about the next generation of the CARES Act and what that might include. I think there's a lot among the experts that Biden is relying on for expanded testing. Although one of the alarming things we've heard this week is that testing supplies are again in short supply. And there's also possibility of reopening ACA enrollment for people who might have lost jobs, lost insurance. Next item. I was asked to comment on the effects of the pandemic on healthcare providers. And there's really been some excellent work being done by Michael McWilliams and some other colleagues at Harvard, looking at the changes in medical spending in areas by their degree of COVID activity. Fundamentally, what they have shown is that there's a dramatic drop-off in use of healthcare, particularly outpatient healthcare. That it varies somewhat, although it really only affects the timing of when that occurs, depending on what the level of COVID activity is in a given. We were just at the end of the summer, starting to get back to the point where we were back to our previous level of outpatient use of care. But I'm now hearing that once again, people are hearing that COVID-19 is on the rise. Cases are rising, hospitalizations are rising, I think we're at an all-time high for hospitalizations in the nation and in many states right now. And all of that means that probably healthcare providers are going to see the effects of this second or third wave, depending on where in the country you are, on their normal operations. And healthcare spending will almost certainly remain below pre-pandemic levels until the pandemic is under control. Next slide, please. So this was the range of different things that Biden proposed to expand coverage and make more affordable by building upon the ACA, but I hope that I've told you that many of these, like those that first three on the slide, really require legislative action. The ACA marketplace is a mix of federal of legislative and executive action required. Providing additional funding to states is funding, and that requires Congress to act. But some of the things on the right-hand slide, the side of the slide here, are possibilities in the new administration and possibly even in 2021, given the state of the pandemic. Next slide, please. So health policy, at least early in a Biden administration, will be focused first on combating the COVID-19 pandemic, second on administrative actions to rebuild the ACA, third on bending cost curve through administrative action. And that's the only one that I haven't spent much time talking about. But for the interested insurers and providers on the call, I would say that the Centers for Medicare and Medicaid Innovation, which was responsible for many of the payment reforms and payment demonstrations in the Obama administration, really didn't come up with too many new initiatives during the Trump administration. Indeed, the first Secretary of Health and Human Services, Tom Price, and the Trump administration, one of the first things he did was roll back and cancel some of those demos. I would expect it to be reinvigorated with a lot of new people and new ideas in this new administration. So that's another area where through administrative action, we might see some health policy change. But fundamentally, we're operating, all of us, because of the pandemic, in a very, very constrained environment. And there are also a number of reasons why politically the Biden administration will be constrained. And if you can just go to the next slide, just so that on the webinar recording, there are a few references in case people are interested in learning further about some of these topics. Thank you very much.
Thank you, Dr. Benton.
Hi, everybody. I'm Trevor Brown, Dean of the John Glenn College of Public Affairs, and it's a pleasure to be here. A big thank you to Amy Rowling-McGee and the folks at HPIO for inviting me. I'm going to try and advance slides. Let's see if this works. Not working on my end either. So perhaps you can do the favor for me and advance the slides. You can go to the next one too. Okay, it looks like actually I do have control. Thank you. I'm good. So I was asked to talk about how the 2020 election will impact the state political landscape. And I'm going to do that by posing the sort of perennial question of whether Ohio remains a bellwether, a microcosm of the American political landscape. So I'm going to show you some results from Ohio here, both at the national level, the votes for the presidency, but also state, local, or state level as we look at the state house. And then I'll wander into that dangerous territory of making predictions, a little bit of prospective thinking about the policy priorities and challenges that the state will face, looking through the prism of the governor, the legislature, and the federal government. And Dr. Bunton's done a great job of painting the federal landscape. So that sets this up well. So each 4 years, we ask ourselves, as Ohio goes, so goes the nation. Do we remain that bellwether, that sheep with the bell leading the flock? And we should say that there's some bromides out there that people often point to. For example, that no presidential candidate has won the national election without winning Ohio since John F. Kennedy did it in 1960. And no Republican has ever won the presidency without winning Ohio. And that begs the question, why is that? Why is it that Ohio is seen as a bellwether? And the argument to date has been that Ohio is a literal representation of America. If you grabbed the census and you basically took every dimension, age, gender, race, religiosity, income, rental versus home ownership, the claim is that Ohio is literally the median on every one of those dimensions. We are the middle on everything that represents the country. We have a mix of urban and rural. We've got big cities like Columbus, Cincinnati, and Cleveland. We've got mid-sized cities in Dayton and Toledo, but we also have lots of small townships and hamlets and other things, and we're also a very rural state. So we sort of, the argument go, we have everything. So in many respects, we reflect the nation. And if you look back since the 1960s, that fateful election when John F. Kennedy won without winning Ohio, you see it at the gubernatorial level in here. I'm just going to read them off, a little trip down a memory lane. DeSalle, a Democrat in 1960. Rhodes, a Republican. Gilligan, a Democrat. Rhodes again, a Republican. Celeste, a Democrat. Voinovich, Republican. Taft, Republican. Strickland, Democrat. Kasich, Republican, and now DeWine, Republican. So that's 60 years of gubernatorial leadership here. And over that 60 years, you see a lot of alteration, a lot of shifting back and forth from blue to red. So Democrats and Republicans have sort of had an equal shot at running the state. But if you just focus on the last, say, 20 years, you see a different picture. Voinovich, Taft, Kasich, DeWine, with one four-year interlude in there for a Democrat in Strickland. The state's electorate has been undergoing a secular shift. So these 6 figures are the county level maps for the presidency since 1996 up to 2016. We've heard a lot in the last 2 weeks about the blue shift as we count votes and absentee mail ballots come in. But if we look over a longer period of time, not just a couple of weeks during an election cycle, we see a long-term red shift in Ohio and its voting patterns. So again, 1996, that's Bill Clinton's second term, a very mixed state. Some dark blue, some dark red, but a lot of fainter view, which means those were tighter electoral margins. But then with each successive election, you can see that the amount of blue declines and the amount of dark red grows until we get to the sort of bookend of the Clinton years, 2016, when Hillary Clinton runs and wins very few counties in Ohio. And interestingly, you may recall that Hillary Clinton was criticized for not aggressively campaigning in Ohio, but in a world of scarce campaign resources, as you look at these trends, that might have been a wise, miserly choice. So now, where are we today? Here's the, as of this moment, and there are obviously still votes to count, about 5% of the votes are still out. This is Biden versus Trump here in Ohio. And at the moment, that's about an 8% gap. Odds are good that'll close a little bit, maybe to 6% as they count the remaining absentee ballots and provisional ballots. But even if that's the case, in political terms, Trump thumped Biden here in Ohio. And there's several things to highlight in this map. So Biden basically won the urban counties, the areas around Cleveland, Columbus, Dayton, Toledo, and Cincinnati, plus Athens there in the southeast. That's 7 counties, ostensibly. Trump won 81 counties. But not only did he win most of these counties, the numbers here are the voting percentages for Trump in each of those counties. There are only a handful where we're in a really tight margin, say 50 to 53%. That's 4 counties. Most of these are margins in the 70s and 80s, which is just remarkable in political terms. So for Democrats to become competitive in this state, it's not that they necessarily need to win those counties, it's they need to make those margins shrink. And right now those margins are just astronomical. So we heard a lot of talk about how this election was going to be a blue wave for Democrats. And in many respects it was. Turnout among Democrats was remarkably high. But it was also a Republican wave election. And the red wave was much bigger in Ohio than the blue wave. The Democrats picked up one county, they picked up Montgomery, but they lost two. They lost Lorain and Mahoning up in the sort of northeast of the state, areas that they've historically been able to hold on to. Now, national turnout, as we heard from Dr. Bunton, was at record levels. It was right now the count is probably about 66, 67%. Here in Ohio, it was closer to 80%. That's remarkable. That means that there aren't that many more eligible voters to turn out. So neither side can sort of claim that these results are the result of sort of dissipation among the voting electorate. On the contrary, this was a high turnout election. So I was asked to host a conversation with Governor DeWine just 2 days after the election, at least voting had completed, by the Success Group's Impact Ohio conference. And I asked the governor whether he thought Ohio remained a bellwether state. I didn't provide this data in detail, but sort of painted a very high-level picture. And without bragging, he tabbed Ohio as a center-right state. And I think this data seems to bear that out. Now, some of you may say, well, isn't this a function of gerrymandering? Isn't this a result of the way we construct electoral districts here in Ohio? And to investigate that question, we can sort of probe some of the down ballot races, the U.S. House races, and the state house here, and the House and Senate races at the state level. So what this chart shows is the presidential, congressional, and state house vote share relative to seat pickups. So that sort of ratio of how much of the vote did they accrue versus then how many seats or electoral college votes did they pick up. So the bright red bars and the bright blue bars report the vote share for each party, for each race, and then the electoral college or seat share that they picked up just beside it in a lighter shade of the same color. So on my left, that's the presidential vote. You can see that Trump currently commands about 53% of the vote, and Biden has 45%. That's that 8% gap. So Trump gets 100% of the electoral college votes. It's a winner-take-all system in the electoral college, and hence that's why that lighter bar is all the way up to 1, and there's no bar present for the Democrats. So now let's look at the congressional votes. And so first, recall there were no Senate seats, no Senate races at the national level in Ohio. It was just House seats. And Republican candidates won about 60% of the statewide vote, and Democrats about 39%. So Republican candidates, though, now have about 75% of the seats in the House that are allotted to Ohio, and Democrats have 25%. You can see a very similar pattern for the Ohio House and the Ohio Senate, where Republicans picked up a few more or a higher percentage of seats, and the Democrats lost a share of the pickups, even though they commanded a higher percentage of the votes relative to the seat share that they received. And the Ohio Senate vote looks a lot like that Ohio presidential vote in some respects, with Ohio Senate Republicans picking up a lot of seats and Democrats not. Now, this is evidence that gerrymandering has exacerbated the influence of winning for Republicans at both the federal and state level. But I don't think that's the important takeaway here. I don't think this is a gerrymandering story. I think Republicans, congressional and Ohio House and Senate candidates, the important point is here, you can see they outperformed Trump, which means that with heavy Republican turnout, the Republicans are the dominant party in Ohio and have been trending such for the last several electoral cycles. So again, gerrymandering expands their influence, But that doesn't mean they are not the dominant political party here in Ohio. And one last little piece of data to drive this home. It may feel like ancient history, but it was just a couple of years ago in 2018, the night before the gubernatorial election, Richard Cordray, the Democrat, was favored in the polls to beat DeWine by about 5 points going into election night. And then the next morning, when we all woke up, DeWine had won by just under 4 points. And nationally, 2018 was a wave election for Democrats. So that again emphasizes that Ohio is sort of no longer a bellwether state, and as the governor said, it's a center-right state. So what does this mean for policy priorities for 2021? And again, I'm in that dangerous territory of making predictions, and that's a dangerous thing to do. So in putting this together, I was sort of reflecting back on the conversation I had with the governor a couple of weeks ago, and I asked him about a variety of policy areas and priorities for the coming year, and what impact he thought the election results would have. So this is sort of distilled in some way from that, as well as my own reading of the political landscape here in Ohio. So the first three on this list are not surprising by any means, but they do warrant a little bit of discussion and some speculation. So the first one, COVID-19 has been the predominant policy issue here in Ohio for now almost a year, and the high likelihood is that that's going to continue even with the announcements of the vaccine results, preliminary though they may be. This is not going to make COVID as a policy issue go away here in Ohio. Case counts are skyrocketing across the country, and absolutely that's the case here in Ohio. And some of you may remember that just last week, DeWine gave his sort of second statewide address last Wednesday, and this is on top of his almost daily press conferences, and it's all COVID, 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 COVID. That's not a surprise, I'm sure, to any of you. But what is surprising is from a political standpoint, the prediction, I think, going into the new year is that where DeWine is going to continue to face the most political headwinds is from his own party. The Ohio Republican Party, even though it is dominant, now having supermajorities in both the Ohio House and the Ohio Senate, it is by no means monolithic. And we saw signals of this in 2019 when Larry Householder ascended to the speakership in the Ohio House. He had to do so, beating the incumbent Ryan Smith, with a coalition of Democrats to secure his speakership. So that's a signal that the Ohio Republican Party doesn't think with one mind and one voice. And just yesterday, we saw another hint of this when President Trump ostensibly tweeted that he welcomed a primary challenger to Governor DeWine, who, just before we forget, was the co-chair of the Trump re-election campaign here in Ohio, again, a state that Trump won handily. And note also that Trump is encouraging a primary challenge for a governor who's got an approval rating of almost 70%. So what this means is if DeWine pushes for more stringent public health mandates, and he does it sort of too far in political terms, he's going to certainly face increasing resistance from his right flank that are going to make governing far more challenging in 2021 than it was in 2020. And that's because there's now no fear of a blue wave. Going into this election, there was the sense that Ohio was a coin flip, and we may be at a point where we're going to see a tilt in a different direction. That was not the case. So Republicans on the right don't have to fear that pressure. Second will be the economy. Not surprisingly, the steady drumbeat of other data that comes out every week are joblessness claims. And so this is second only to COVID and grabbing headlines. So in the short term, the real pressure will be on business support and unemployment. But there's a longer term conversation once COVID comes to some form of conclusion and people can get back to work and unemployment gets healthy. There'll be a lot of focus on the composition of Ohio's economy. We've been an agricultural and manufacturing and now to some degree an energy state, but we have fallen behind economically relative to our peers. We are very much middle of the pack and we're lagging in terms of unemployment. And then these two issues will combine to continue to have big pressure on the budget. The rainy day fund will be likely tapped and spread out, but we're going to probably see the maintenance or even extension of reductions of state spending as we head into the second year of this biennium budget. That may change with CARES funding, and you heard a little bit about that from Dr. Bunton, but I think the prospect of a big CARES spending package is low. We're going to see something more like what Republicans at the federal level were proposing pre-election than we are what the House Democrats were proposing. There's a basket of other issues that are on the mind of the DeWine administration and others, the HB 6, the energy bill, families and children, particularly foster care. Gun violence was something that was very much a priority prior to the pandemic. And we're having a national conversation around race and policing. But I think all of these things will be secondary, if not tertiary, to the trio I mentioned at the top. So just taken together, the focus is going to remain COVID, 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 followed by the economy, the economy, the economy. And these two issues are likely to continue to fracture an increasingly dominant Republican Party here in Ohio. So I'll stop and thank you for the opportunity to share some thoughts.
Well, thank you. Thank you to both Dean Brown and to Dr. Bunton. And I think we're going to need to go right into our next presenter. We do have a couple of questions that are, I think, more geared towards Dr. Bunton's remarks. I'll just read those, and then we can always ask Dr. Bunton to respond and share those responses later. But the first question was, what are the long-term and short-term pros and cons of federalizing the COVID-19 response? And then the second was, will, in quotes, unwind Trump's ACA regulations include rules on provider and payer transparency? So given, though, that we have Dr. Shaw on the line, and Dr. Shaw leads a local public health department, or the local health department in Houston, Texas, and I know right now is a time where his time is at a premium. I think we'll just go straight into Dr. Shaw's remarks, and Melinda, if you don't mind, maybe we could follow up with those two questions afterwards. Is that okay?
Fine. That's fine. Happy to answer them.
Okay, great. Well, thank you both for your informative remarks and for spending some time with us today. It's with pleasure that I introduce our next speaker, Dr. Umair Shah, who is the Executive Director of the Harris County Public Health Department, which is in Houston, Texas. I met Dr. Shah briefly a little over a year ago in an elevator at a national conference, and in our very, very quick conversation learned that we both grew up in the same neighborhood at the same time in Cincinnati, Ohio. So that was my inroad to asking him to come and spend some time with us today. He also has roots in Toledo, where he did his medical education. So Dr. Shah, without further ado, we'll let you take it away.
Thank you, Amy. Can you hear me okay?
Yes, we can.
Great, great. Well, thank you so much. And I have to say it's an absolute honor and thrill to be, whenever I speak to anybody from Ohio and the Buckeye State, you know, I shouldn't say this, but I am a continued Cincinnati Bengals fan, Cincinnati Reds fan. Unfortunately, over the years, they have not done me right, but I remain committed to those, you know, to Ohio from that standpoint. And it's just a pleasure to be with all of you. I know there are some very concerning, worsening statistics and transmission rates, and the move from threat levels that are really more red now across Ohio. And I know that Governor DeWine has really sounded the alarm, and I would just want to echo what I've been hearing from both the governmental officials as well as the public health officials. Let me back up, the elected officials and the public health officials, which is that we are nowhere out of this pandemic. And I think it's important for all of us to be thinking about that. I've been starting to use the phraseology that this is, again, not a sports metaphor, but I apologize for using it, that if you're in a football game, this is the first half. We've got halftime now, we're in it. It's what we're going to do over the holidays. We got to re-energize and all those things and our spirits and our energies. But we are nowhere out of this game, and we have a second half to play, which is going to include vaccines, vaccine distribution, and also all sorts of other preventive measures in the 2021 and perhaps beyond. The unfortunate piece is that if we do well during this halftime, we're going to position ourselves well for the second half of this game. And if we do not, then unfortunately, we're going to see more people get sick. And that is really the challenge. And unfortunately, we've seen a political football of COVID-19, that this has not been a public health or evidence-driven or science-driven response in this nation. And that's just a tragedy. And unfortunately, it is that we are seeing public health be politicized. And so something as simple as wearing a mask, just a mask, right? It was on CNN this morning, and I mentioned that, you know, when I tell patients, and I've been practicing for 15, 20 years, take your blood pressure medicine. You know, guess what? They take it. They don't politicize it. They don't say it's, you know, why are you telling me this? Or these things work, and this is what we've got. And we've got to do our best to really get the word out about what I call the 3 W's plus the 4th W that I've added, which is wear your mask, wash your hands, watch your distance. Yes, we've heard that, 3 W's, but it's will. The 4th is political and collective will, the individual will of following through on a meticulous, comprehensive basis, day in, day out, about wearing those masks, washing those hands, watching the distance, and then get tested. Those are the real key tenets of this until we're closer to vaccine and out of this, and we're not there. And so let's make sure we underscore that across Ohio. I've got family, friends still in the Buckeye State, and I just want to make sure that they are safe and they are sound, as all of you are. And that's why it's so important that we take a policy look at fighting COVID-19. So that's where I want to start. I did have some slides. I don't know if you're able to show those slides. Well, there you go. I guess I said a lot during this this first part of this. I will say that I have championed this hashtag invisibility crisis. Please follow me on Twitter and our department. It is true that we are public health largely invisible. The value proposition, what we do, is largely unknown. So I've championed over the years that we need to raise the visibility of public health. When you raise the visibility, you raise value. When you have value, you increase the sort of validation of that is by pro-health resources, pro-health policies. And I think if there's ever been an importance of public health, I think COVID-19 has shown that. Next slide. So we're big, we're diverse in every sense of the word. You know, about half the population, I guess, of the Buckeye State is in our county. We are spread over the size of Rhode Island. We're larger than 25 states, but it's not just that we're large, we're also incredibly diverse with no majority population in our community. And that means so much as we, again, think about all the needs of our community. Next slide. We believe strongly in innovation, engagement, and equity. These are our cornerstone values. Next slide. It's our road to health, and really how we promote health is that we believe it happens in the community. Those social factors of health happens where you live, learn, work, worship, and play, LLWWP. Those are really how we think about the inputs to health. Next slide. Harris Cares 2020 was a landmark report that we released last year, and it really described the vision of health in our community, and it showed that we have a 24-year life expectancy difference between the lowest census tract and the highest census tract in our community, the largest such disparity across the state of Texas. And it also underscored the importance of healthcare access, the importance of social vulnerability, the importance of the real uninsurance rate. We're a Medicaid non-expansion state, and then ultimately the importance of chronic health and fighting chronic health conditions in our community like obesity and diabetes and underlying asthma, et cetera. Guess what? All of those factors are in play now in 2020 as we look at COVID-19 and beyond. Next slide. I think you know this. Next slide, that health is more than healthcare. It's really about what we all do in the community. We also believe strongly in global health. Next slide, that global and domestic health come together as COVID-19 showed. We as a department are the only public health agency in the state of Texas that has human health, animal health, insects, entomology, and environmental health under one roof, and we take a One Health approach to that. More people, more places, more travel to and from more places, and more vectors and more cases. And I think COVID-19 brings up the importance of the environment and why the jump from a novel virus from animals to humans is absolutely critical to our ecosystem as well. Next. We must invest in public health. It is not a line item on a budget. We all think it is. It's not on an Excel spreadsheet. It is truly an investment, and we would be better served as a nation if we invested in public health and did everything we could from the long-term impact of health and not just healthcare delivery. And I think that's why public health is so important, and that's why the invisibility crisis is such a key piece that's missing in our dialogue. Next slide. Health equity is very important, and it's the key driver, as I talked about, innovation, engagement, and equity. We believe equity is so critical to everything we do. We must be thinking about disproportionately impacted communities within our larger community, within the larger state of Ohio, within the larger state of Texas. We have to think about all of us, and I think that health equity approach is absolutely critical. Next slide. But you know, public health is inherently political. And we know that. One of my colleagues termed the term public health it's political. It's public and it's political at the same time. And I think we've got to really be thinking about that. And COVID-19 again shows us that. And unfortunately, that's something that we are very much facing every single day. Next slide. But we can work together to build healthy communities, but it's going to really be about all of us working together, and we have to do that, and we have to do that well. Next slide. I believe the 3 V's of public health and that visibility, the value, and the validation, everybody knows the quarterback, right? So everybody knows Baker Mayfield or Joe Burrow, Deshaun Watson for the Texans. Everybody knows the quarterback, and that's healthcare delivery. But nobody knows number 68 or number 71 or 76 on the offensive line. That's public health. And the problem is that in health, we invest in the quarterback. We hardly invest in, unfortunately, in the offensive line. And so when Tom Brady wins the Super Bowl, we don't gut the offensive line, but that's what we do in health. We gut the offensive line when measles rates come down, TB rates come down. We've done a good job with emergency preparedness. We defund it. We do all sorts of things, and guess what? Those rates come back up, or we have problems, or you have COVID-19 and we're not ready. So we have to invest in the public health offensive line, and that's that invisibility crisis that rears its ugly head yet again. Next slide. So in 2005, on the left, I had hair. It was not gray hair as now. It was during Hurricane Katrina response at 2 o'clock in the morning when I asked for not new widgets or things. I asked for common sense, and I would say that has stayed with me. The public health just makes common sense, but it takes a village. Here's some images of the people at 2019 when we released Harris Care's vision for health in our community. As you can see, we're not socially distanced, we're not wearing masks. even early when we had our first health alert that we released January 9th, and we went into incident command mode in February. This is a picture of our team coming together, again, not socially distanced, not wearing masks that time. But public health takes a village. It's all of us together, and it makes common sense. And so I think it's important for all of us to be thinking about the policies and the investments that are necessary to protect and improve the health of our communities and the people who live in those communities. So with that, I just want to say thank you to all of you for everything you're doing. Please listen to the governor. Please listen to public health officials. You see, whoop, wrong side, whoop, right there, right there, right there. COVID-19, you know, let's kick its butt, and we can drive this pandemic in the ground, but it's halftime, and we've got to make sure that we're ready for the second half. So with that, I turn it over to you, and apologies, and maybe I should have said in advance for using all the metaphors that I tend to use during my talks.
Well, even though I have those footballs on my bookshelf behind me, some of your metaphors did go over my head, but we appreciate your remarks, Dr. Shaw. I don't have any questions in the question box. Oh, look at that.
Yeah, we'll make sure everybody knows, right? Yeah. Put the helmet on. I mean, I'm ready. So I just want you all to know, a true you know, Ohioan at heart. It's been my home for you know, a couple of decades. I grew up there, some of my best years of my life, and I just want to make sure that we all do everything we can to help protect everyone in our great Buckeye State. So please work together to do that.
All right, well, great, thank you. We don't have any questions for you. We had one comment validating your statement regarding the need to invest in the invisibility, the offensive line, so to speak, of public health. So thank you for all the great work that you're doing down in Texas, and for spending some time with us today.
You got it. Thank you so much. Appreciate it.
Great.
Bye.
Bye. Okay, well, everyone, if you could just take a tiny break here. Don't leave us, but stand up, stretch, move around a little bit. It's always helpful to have that reminder when most of us are at home all day long. So continue to move your body even throughout the forum. Our next set of presentations is actually going to be a panel conversation led by HPIO's very own Reem Ali. Reem is a vice president with our organization. She has been with us for about 9.5 years. Her educational background is she has a JD and an MHA from The Ohio State University. She has led our equity work among other projects for our organization, and is going to kick us off with a presentation regarding a recent brief that HPIO put out, and then facilitate the panel conversation. Good morning, Reem.
I was muted. Good afternoon now, Amy. How are you?
Good afternoon. We're 1 minute past noon. Okay.
1 minute past. Well, thank you, Amy. And what I'd like to do is lay the foundation for our panel discussion that we'll be having in just a bit on health equity and racial justice in Ohio, by providing some more specificity on the connections between racism and health. As you heard from Dr. Shaw, in Harris County, they had a 20-year gap in life expectancy. In Ohio, we have a 29-year gap in life expectancy, depending on where you live. And as just an example of disparities that communities of color face in Ohio, Black Ohioans are expected to live on average 4 years less than white Ohioans in our state. We're seeing very troubling disparities, and with COVID-19, we've really been moving in the wrong direction. When we talk about COVID-19 disparities, like the many other disparities experienced by communities of color in Ohio, they're really just the tip of the iceberg. They're indicators of more deep-seated issues that must be rectified. And it's important to recognize that these gaps in outcomes faced by Ohioans of color, and specifically by our Black and African American community in Ohio, around COVID-19 and other health outcomes are not a result of behaviors or genetics. The evidence, the research evidence is clear that racism is the primary driver of these inequities and disparities. HPIO recently released a brief that goes into detail on the relationship between racism and health. And in talking about racism, it's important to understand the levels at which it operates. What you see here is Race Forward's 4 levels of racism framework. We've found this at HPIO to be a useful tool that others can use as well to better understand how racism takes shape in our society. So I'm going to start with the bottom rung that you have on your screen, internalized racism, which describes an individual's privately held beliefs of prejudice, oppression, and privilege regarding their race or the race of others. This includes feelings of white superiority or a person of color's feelings of inferiority. For example, a person of color may have internalized negative views of their hair and its natural texture or style. And those are views that have been instilled or reinforced by society, by organizational policy over generations. When we talk about interpersonal racism, that describes when individuals, through their interactions with one another, act on beliefs of racial prejudice, stereotypes, oppression, or privilege. That can be through indirect or direct acts of unfair treatment, bias, or violence, and this is what is most commonly thought of when we talk about, or there's a discussion of, racism. Then that next rung, institutional racism, is when beliefs of racial prejudice, oppression, or privilege are acted on or perpetuated by institutions or organizations. This is where we see fewer people of color being hired or promoted within an organization. And then we have structural racism, which occurs within and across systems in our society, leads to disinvestment from communities of color through historical practices like residential redlining and even present-day gentrification. Systemic racism, which includes both institutional or structural racism, is really the most pervasive driver of the poor outcomes facing communities of color. This figure outlines the relationship between racism and health. The connections are quite complex and interwoven. Racism impacts health both directly and indirectly through exposure to traumatic events, violence, toxic stress and stigma, increased risk for engaging in unhealthy behaviors, and policy and system inequities. That's a lot, so I'd like to break it down a bit more for you. First, by providing an example of how racism through trauma and toxic stress impacts the health of communities of color. Toxic stress results from a prolonged activation of our body's fight or flight stress response system, and that can be caused by experiencing traumatic events in life, including experiences of racism or racial microaggressions. National data indicates that Black children are 9 times more likely than white children to be treated unfairly due to their race, 9 times more. What research tells us is that repeated exposure to trauma or racism can lead to physiological changes to the body that cause a wear and tear effect on a person's nervous, endocrine, and immune systems. And over time, as you can imagine, this wear and tear effect contributes to poor health outcomes, leading to high blood pressure, heart disease, stroke, depression, and even early death. People who are exposed to chronic racism are also more likely to engage in unhealthy behaviors as a way to cope with the trauma and stress that they are experiencing. And engaging in unhealthy behaviors can actually have a beneficial or protective effect on a person's mental health in the short run. However, as we know, of course, engaging in unhealthy behaviors like not eating healthy or smoking are significant contributors to poor health outcomes. The graphic on your left shows that the more trauma or adversity a person experiences early in life, the more likely they are to smoke. Traumas like experiencing racism. And to illustrate the impact of this, on the right, you see a bar chart that shows that middle-aged Ohioans who are Black are twice more likely to smoke than white Ohioans. Racism also leads to policy and system inequities, which contribute then to poor health outcomes. For example, data demonstrates that communities of color face implicit biases and racial discrimination within the healthcare system, including underrepresentation in the healthcare workforce. Black patients were often denied treatment in the past because of their race and were subject to racist and unethical medical research practices like the Tuskegee study, which is what you see in this picture, an experiment of untreated syphilis in Black men that lasted 40 years. And even in clinical care today, studies have found that many white physicians implicitly, so not with conscious knowledge, hold anti-Black beliefs. This might manifest in things like writing off some of the health concerns and questions of patients of color, or maybe not taking their complaints of pain as seriously. A survey in 2016, so it's a relatively recent survey, found that 58% of medical trainees incorrectly believed that Black skin was thicker than white skin. For these reasons, people of color have an understandable mistrust of and are less likely to engage with the healthcare system. And a recent Kaiser survey found that nearly 6 in 10 African Americans do not have trust in the healthcare system to do what is right for their communities, which in light of the COVID-19 pandemic is incredibly troubling. To support efforts to eliminate racism, HPIO adapted the 4 levels of racism framework to create this action steps to eliminate racism and advance equity diagram. The diagram outlines how individuals and groups, public and private organizations, and state and local government leaders can work to eliminate racism and advance equity at various levels within society. And there are more specific action steps associated with each of these actors. And you can find that information on HPIO's website along with other resources. We know that racism has put in place and maintained obstacles to health for communities of color for more than 400 years, and that work to address this is quite daunting, but improvement is possible, and there are actions that we can all take. So I'd like to shift gears now to have a dialogue with our panelists about what action steps their organizations are taking to advance health equity and racial justice, and what the current environment, what current politics and perceptions mean for taking action. So we have with us this afternoon, you'll see them joining me on your screen. We have Liliana Kavanaugh, who is the Executive Director of the Ohio Commission on Latino Affairs, Dr. Gregory Lamb, who's with the Ohio Asian American Health Coalition, Randy McShepard, Chairman and Co-founder, Policy Bridge, and Vice President, Public Affairs and Chief Talent Officer at RPM International Incorporated. And then we also have Denisha Porter with us, who's the Director of All In Cincinnati, and Tamika Rose, who is the Health Equity Ambassador and Assistant to the Mayor for Public Policy in the City of Akron. So a fantastic panel this afternoon, and I really appreciate all of you joining us for this discussion. I'm going to go ahead and open it up with a question or two, but I do also encourage those of you in the audience to ask questions as well, and we will share those with our panelists as time allows. So you are welcome to type your questions into the question box. So first, I'd love to hear from all of you what steps your organization has taken to address racism and racial inequities and disparities, and if you could maybe just speak a little bit about what's worked in terms of garnering internal support for these efforts.
And I can get started.
Okay, great. Thanks, Lily. Yes.
So I represent the Latino Affairs Commission, and I just want to start off by pointing out that just the fact that we exist as a Latino Affairs Commission representing Latinos in Ohio is a sign of our work in this space of diversity and inclusion. Trying to serve. And being that we are the only minority ethnic community that has representation through a state commission, although there is a new African commission, they're not funded. And there has been in the past a Pacific and Pacific Islanders and Asians advisory council, but they're not. So it's really critical that we as Hispanics represent not only Latinos, but the diverse ethnic minorities in the state of Ohio. So increasing that public awareness has been very important, speaking on the issues of equity and inclusion and supporting and participating in as many forums as we possibly can. I think that the key point that we always try to address is that there is an unintended but real barriers that are in place that are impacting access and quality of care. And that is a message that we constantly try to drive in every forum that we're able to participate. And also, on the other hand, we need to help our ethnic leaders to be able to articulate what are the conditions that are creating those inequities and what are the obstacles that are not allowing them to be able to proceed towards integration and healthy choices. Data plays a critical role in all of this because there's not enough disaggregated data that helps us understand some of those conditions. And then, of course, externally, we always need to drive that message and always be counteracting the narrative that you hear in the social space in regards to who are the immigrants, who are the migrants, who are ethnic minorities. What do they bring to the state? It's much easier to talk about 1 million ethnic minorities here in Ohio and growing, that together with our African American community, we make up 21% of the state's population. That is much easier than just say, well, I'm just going to speak on behalf of 100,000 new African immigrants. So numbers matter quite a bit.
So if I could just pick up on that, Reem, and I want to thank Reem and Amy for hosting this really important forum. And so there's a lot to follow up on with what Liliana talked about. So I represent the Ohio Asian American Health Coalition, and COVID-19 in particular for Asian Americans has been particularly tough. It's been a catalyst in many ways, in obvious ways and not so obvious ways. It's been a catalyst for good and for bad. The bad is obvious, the health detriments, the death, the morbidity, the mortality that we've experienced. But from the Asian American specific standpoint, a lot of the racism that Asian Americans in Ohio and across the nation has experienced. I personally have experienced a lot of racism specifically because of COVID-19. But this has brought up a lot of points, in many ways has kind of galvanized the Asian American population. One of the things that I thought was really helpful was the Ohio COVID-19 Population Needs Assessment that I think many people here have participated in. And they came up with very specific recommendations. I think in many ways, this is a framework of how we can proceed to actually help address racial inequities and health inequities for the minority populations. But what they did for people who weren't involved or aren't familiar with it, they surveyed key stakeholders. They asked them specifically, what do we need to do to address health inequities? They analyzed the data, and then they came up with top priorities and key recommendations. And hopefully we can act on these things. One of the top things that they talked about was for state leaders to recognize that racism is a health crisis. We have to acknowledge this, because only by acknowledging this, that we can then have conversations with our public leaders to have educations or education initiatives and to address policy change from this. And then more specifically, they talked about some of the cultural barriers that Liliana talked about too, specific for Asians. And these have to do with cultural barriers, language barriers, access barriers, economic barriers, and also perceptions as well. And perhaps if we have time, we can talk about that in more specific detail, but I want to let some of our other panelists speak as well.
Thanks, Dr. Lamb. And thank you, Lily. Denisha, maybe you can talk a little bit about what your organization has done, some steps that they have taken.
Yeah, definitely. So we are definitely All in Cincinnati is about eliminating racism and advancing racial equity through a coalition. And it's simply stated in our mission statement, which is All in Cincinnati is a racial equity coalition focused on dismantling racial inequities in our 5 priority areas of health, housing, education, economic mobility, and justice, with the goal of uplifting Black women in Hamilton County. And most recently, we were highlighted in the county's declaration around racism as a public health crisis as an organization to work with and move forward our All in Cincinnati report and strategies around racial equity. And most recently, we were selected to be a part of the Cincinnati Racial Equity Task Force to help develop additional racial equity strategies. So I believe the coalition is important because it gives voice to the community to make those changes and to understand the impact in the community.
Thanks, Denisha. And Tamika, if you have some thoughts to share.
Yes. And I wanted to say thank you, Reem and Amy, for inviting me to speak today on this very important issue. The City of Akron, I am the Health Equity Ambassador for the City of Akron, and I was hired in 2017 to help coordinate the efforts around infant mortality. Well, coordinating the work is not really what I'm doing. I'm more of leading the coordination, so to speak. So coordination is just putting everybody in a little box. You do what you need to do. So we actually created term first birthday. But what we've done in that collaboration is that we actually look at the social determinants of health that impact the women's health. So housing, workforce, transportation, and the implicit bias that exists within the healthcare systems. What we've done since COVID-19 is we actually declared racism as a public health crisis in the city of Akron. And we also created a racial equity and social justice task force, which is led by one of the community leaders, Bishop Joey Johnson. It's still in the infancy stage. We've only had about 2 meetings, and we have about 5, I think it's 5, it might be 6 different subcommittees. And it's not the city leading this. This is actually the community putting together recommendations of how the city could go forward to remove racial inequities within our city. We're going to start with the city first and then go into the business community second. This will be a 5-year strategic plan. And so we're really looking forward to begin to eliminate the racial inequities in the city of Akron. And hopefully it will bleed out into the state as well.
Thanks, Tamika. And Randy, if you can talk maybe a little bit more about what your organization has done to advance equity and address racial disparities and inequities. Randy, can you hear us? We can't hear you. No, we are still not able to hear you. Okay, well, hopefully we can come back to you to get your perspective on what has been done. But let me move on to the next question. And Randy, whenever you think you have audio, please feel free to just go ahead and speak up. Nothing. Okay. All right. Well, several of you had mentioned that it was important to acknowledge racism as a public health crisis. So I'd love to hear, in your opinion, how you think politics has impacted perceptions on the issue of racial justice and acknowledgement of racism as a crisis. And maybe I know a couple of you have mentioned it, but maybe we start with back with Tamika and what you think that has meant in this current environment.
That was a very loaded question, Reem, but I think that in today's political environment, gotta take a step back and go to our infant mortality numbers to make the correlation. So in Akron and Summit County, our infant mortality rate was decreasing. We were doing a really good job. And we still are. And I don't want to take that away from the young community health workers and doulas. But with the election that really began in 2019, right? The vision that was so prevalent that you could see people were saying different things that they normally wouldn't say. They were treating Black and brown people differently. They were not being politically correct. That stress impacted minority women, Black women in particularly. Therefore, when the numbers came out recently, you can see the impact that racism has played on the numbers. So you can see that data. If you look at the data from 2008 and then look at the data now from 2018, you can see that the disparities in healthcare have grown, or they were going down and then they started to come back up. And so that is where we are saying that racism is the key. We can put all of the wraparound services around the community, but until we remove the structural racism that is embedded in the policies, we're going to be stagnant. And we also need to try to change people's mindsets around how people are I don't want to say that we are the same because we're not, but we are all deserve to be treated the same. We all deserve to be treated with respect. And when you don't respect your other humankind, brothers and sisters, that is when you lead to the disparities that we experience today, which also can go to economics and all of that other great stuff that you all talk about all the time. So I'm not going to go into that. But I do want to say that I think that with the political environment now, we really need to take a step back and really start to re-educate some of our politicians, because unless they admit to racism being a problem, we're going to continue to see this going forward.
Thank you, Tamika, for taking on that very loaded and challenging question. And I'd love to open up to the other panelists if you have additional thoughts on this and the role that politics has played, and add to that what you think the most important steps that can be taken by our policymakers to address this issue are. So what do you feel like are the most important action steps that can be taken by our state policymakers to really go ahead, Dr. Lam.
So this is something that politics and racism, particularly in the COVID pandemic, has been particularly damning for the Asian American populations. You know, careless use of the terms, the China virus, the Kung flu, has really exacerbated racism on all four levels of the framework that you showed. Reem. Certainly a lot of the interpersonal things have surfaced. So a lot of the people in the Asian communities, they were afraid to wear masks because they were afraid that by wearing a mask, it would basically make them a target from other people. We've seen increases of the interpersonal racism. So the Pew Research Center had a survey where they said that a third of the respondents, Asian respondents, have received some sort of verbal abuse or harassment. The Stop AAPI hate organizations in just a 20-week period recorded over 2,600 incidents of harassment and abuse against Asian Americans. And as a result, we've seen a twofold increase in the use of mental health services for the Asian American population. And this is all a result of the political discourse that we've had. So in answer to the second part of your question, I think there's a lot. There's a lot that we can do, that a lot of things that our politicians can do. Number one, and I mentioned this before, is to admit that racism is a public health crisis. We have to admit that, and we have to talk about this because this will lead to, for instance, forums like this, where we can discuss this. We can just discuss ways, concrete ways to overcome these obstacles, a lot of these cultural obstacles, a lot of the implicit bias that we have, a lot of these other things that we're finding out can adversely affect the health of populations, in this case, particularly the Asian American population.
Yeah, and I think too, if I may add to that, I'm sorry, I just wanted to piggyback on that because I think the impact of trauma is something we need to recognize within the Latino community all over the country, as well as the refugee and other immigrant communities. These are people that have already been so traumatized by past history, and this whole COVID-19 plus the political environment and the way how you know, our conversations regarding race have come about have really triggered these very dramatic changes in mental health and behavioral health that we are not really acknowledging enough. And I wanted to just say that I feel very proud of our state of Ohio because we did come together. We created a minority health strike team. There is an actual blueprint that has been reviewed by the administration. Governor DeWine responded to that blueprint. And so there's now very clear guidelines as to how the state of Ohio will move forward to make sure that we are able to dismantle racism. But I think from the aspect of the policymakers, something that is really important is just focus on creating the right conditions. I mean, we need to get back to basics. And dealing with these social determinants of health are going back to basics. We know that those are 50% of the conditions that are going to determine the well-being or not of people. And then the second thing that I want to say is that they must begin using a health equity lens on every aspect of their policy work, which is something that has not been there. And lastly, we need to make sure that the people who are being talked about and represented are part of the conversation. So we need to increase our workforce development and empowerment of representation of these different growing communities, because there's no way you are going to know everything that you need to know. We need to be a part of that conversation.
Right. Yeah, and I just wanted to follow up with that. Liliana, you did a great job providing an overview, but some simple things that I think that state policymakers can do is promote racial equity trainings and ask your staff to attend those racial equity trainings. Currently, right now at the Greater Cincinnati Foundation, we have what is called Racial Equity Matters. It's a two-part series. The first part is groundwater, which is kind of like an overview of racial disparities and racial inequities in those 5 priority areas of health, housing, education, economic mobility, and justice. And then there's a smaller one, phase 1, where it's more intimate and you're able to internalize all that data and that information that was presented in groundwater in a smaller group to talk about how racism has personally impacted you. So I would say that that's one way you can do it. Either you can look at Racial Equity Matters or other equity trainings that you can get your staffs involved in, other governmental officials. Another thing that you could do is possibly look at racial healing. So in 2021, All in Cincinnati is going to heavily emphasize racial healing in the community, where we have open, honest dialogue, courageous conversations about racism and how that's impacted you. And we're going to do that in different sectors, so including the health sector, partnering with the Health Collaborative, also in the faith-based organizations, also with businesses and nonprofit organizations. And we've already started some of that work right now with educational institutions, and we now have a racial healing center at the University of Cincinnati. And then finally, I wanted to provide this resource as well. It's called GARE, Government Alliance on Racial Equity. And so this is an organization that governmental entities can become members of, and they have different resources, tools, events, even funding that is available to support moving racial equity strategies within government.
Thank you, Denisha, and I'll let you have. Oh, Tamika, did you have
one more thing? Yes.
Sure. Just real quick, and then wrap up. You'll have the last word.
Just wanted to say, in addition to all of the great things Denisha spoke of, because Akron is a member of GARE as well, what we've done in Akron is also use intercultural development inventory, because some people may not be comfortable like talking about it, but they may be willing to take an assessment to see where they are on that spectrum, if they're in denial, polarized, minimization, acceptance, or able to adapt to different cultures. So that's another different tool that people can take, and it's private. And so I think that might be another tool where people, if they're not comfortable actually having those conversations, could partake in.
Thanks, Tamika, and thank you, Denisha, for sharing all of those resources. And thank you all for participating in this discussion and conversation. We hope that there are more conversations and discussions like this across the state.
Thank you.
Yes, thank you. Thank you all. I wish we had another half an hour to continue the conversation with all of you. So in closing today, we have covered a lot of ground, and we would love to get your feedback on how you would rate today's online forum. So we're just going to have a quick poll question, if you wouldn't mind responding to that. I think, Alana, could you throw that up? Or maybe it was already up. And then you're also going to receive a short survey after the forum via email. And if you could please respond to that and share any feedback that you have about today's event, we'd very much appreciate it. The last item we wanted to cover today is just sharing with you a few ideas of ways that you can influence the policymaking process. You heard a lot of different perspectives today, information about the landscape for national health policy, for the state political environment. We talked about the future of public health and of racial equity. So if any of these topics are of interest to you or passions for you, we encourage you to weigh in with your elected officials at the state, local, and federal level. There's several ways here on this slide that you can do that. You can do it through letter writing. I think the best way to do it is by developing relationships with the people who represent you in various political bodies or policymaking bodies. These are people just like you, like me, and they are there to represent us and want and need to hear from their constituents. So please think about ways that you can engage in the process, help to inform the policymaking process, and increase the number of evidence-based and evidence-informed policies and practices that we're advancing here in our state. So again, thank you. Thanks to all of you. It's really great to see that so many of you who have stuck with us to the end, even though we went a little bit over. Hope you have a great rest of the day. Stay safe and have a happy Thanksgiving. Take care. Bye.